Welcome, Professor Rich RN here. Today we're going to go over fundamental NCLEX questions in your preparation for either your fundamental courses or NCLEX prep. So to get started here, we have a nurse is a preceptor for a nurse who just graduated from nursing school. When caring for a patient, the new graduate nurse begins to explain to the patient the purpose of completing a physical assessment. Which of the following statements made by the new graduate nurse requires the preceptor to intervene? A, I will use the information from my assessment to figure out if any antihypertensive medications is working effectively. B, nursing assessment data are used only to provide information about the effectiveness of your medical care. C, nurses use data from their patient's physical assessment to determine the patient's educational needs. D, information gained from physical assessment helps nurses better understand their patient's emotional needs. So the correct answer on this one is going to be B. So nursing assessment data is always used to evaluate the effectiveness of the aspects of the patient's care. Assessment data is to help evaluate the effectiveness of medications and to determine if a patient's healthcare needs, including the need for patient education. Nurses also use assessment data to identify the patient's psychosocial and cultural needs as well. So the assessment piece, remember that nursing process, that ATI, assessment, diagnose, plan, intervention, and evaluate, that assessment piece is key and no matter what we do. So let's go to the next one. Having misplaced his stethoscope, a nurse borrows a colleague's stethoscope. He next enters the patient's room and identifies himself, washes his hands with soap, and states the purpose of his visit. He performs proper identification of the patient before he auscultates her lungs. Which critical health assessment step was not performed? A, running warm water over the stethoscope for patient comfort. B, cleaning the stethoscope with betadine. C, using alcohol-based hand disinfectant. Or D, cleaning the stethoscope with alcohol. Well, this one, we want to always clean that stethoscope with alcohol. So bacteria or viruses can be transmitted from patient to patient. So we should always clean the stethoscope when we're going back and forth. Betadine is an inappropriate cleaning solution in this step. And hand sanitizer is also something that we wouldn't use in this step. So again, the correct answer is D, cleaning the stethoscope with alcohol. All right, our next one, which is the best examination position for a complete geriatric physical examination on a weak patient with a bilateral basal pneumonia? So which position are we going to put them in? A, prone, B, Sims, C, supine, or D, lateral recumbent? Give that one some thought. So your answer for this one is going to be C, supine. So this is going to be the most normally relaxed position for a patient. It will not compromise the patient's breathing because it's likely compromised with the pneumonia. So we're not going to add any additional stress on them by putting them in that supine position. If the patient does become short of breath while we are conducting the assessment, we can easily sit them up as well. If we're going to look at the lateral or the prone position, both of those can cause respiratory issues or increase respiratory effort for them. And the Sims position, that's not going to be used for assessment. We'd only put them in that position if we're going to be giving maybe a suppository or you're going to assess the rectum or the vagina. All right, so during an annual gynecological examination, a college student discusses her upcoming college break at a tropical location. After the student receives an oral contraceptive prescription, the nurse identifies the importance of skin cancer prevention education by discussing which evidence-based prevention health topic. A, applying water-based sunscreen only before swimming. B, using tanning bed daily for 7 days before a college break trip. C, applying broad-spectrum sunscreen of SPF 5. Or D, taking extra precautions in the sun secondary to that prescription. Okay, so the correct answer on this one is going to be D. So oral contraceptives can make skin more sensitive to the sun, and therefore that need to educate the patient in regards to applying sunscreen is very important. A is not correct because we want them to utilize at least an SPF 15 all the time, regardless of their swimming or not. And tanning beds 7 days prior, although they might look nice and tan before they go, it's really going to can potentially do their skin a lot of harm. And then C is incorrect because, again, that SPF is going to be too low for what we're looking for. Our next one looks at a head and neck physical examination is completed on a 50-year-old female patient. All physical findings are normal, except for fine, brittle hair. Based on these physical findings, which of the following laboratory tests would the nurse expect to be ordered? You have A, liver function test, B, lead level, C, thyroid stimulated hormone test, and D, complete blood count. Okay, so the answer for this one is going to be C, thyroid stimulated hormone test. And the reason for that is part of one of this because of low thyroid disease can make hair thin and a little bit brittle. So that's why we'd expect that one to be that. Liver would a liver test we'd expect if someone was jaundice or heavy alcohol abuse or use, then that would be the liver function test. And CBC is not really indicated in this situation. And there's nothing that leads us to think it's lead poisoning or anything like that. So the correct answer again is C. Varicella is diagnosed on the basis of the illness history and the presence of small, circumscribed skin lesions filled with serous fluid. The nurse documents these varicella lesions as which type of skin lesions? Ooh, okay. We got a vesicle. Is it a wheal, papule, or a pustule? Okay, the correct answer is A, vesicle. Okay, vesicles are elevated skin lesions filled with serous fluid that measure less than 1 centimeter. Wheals are irregular shaped, elevated areas that are superficial. It's usually with localized edema that vary in size. And then the wheals are kind of common with bites or hives of those sort of things. Then you have papules, and which are papule solid elevation to the skin that are going to be smaller than 1 centimeter. And pustules are elevated to the skin similar to vesicles, but they are not, but they are filled with pus. So there is an NCLEX lesson I have on skin disorders. So if you got this question wrong, I'm going to go ahead and point you to that direction to kind of review those as well. A school nurse recognizes a belt buckle shaped ecchymosis on a 7-year-old student. When privately asked about how the injury occurred, the student described falling on the playground. Upon suspecting abuse, the school nurse's best action is which of the following? Interviewing the patient in the presence of his/her teacher, ignoring the findings because child abuse is a declining problem, and C, realizing that the abuse victims usually report abusive situations, D, contacting social services and reporting suspecting abuse. Hopefully you chose D on this one. So remember, as nurses, we are mandated reporters. So as a mandated reporter, we need to contact social services and notify them of our suspicion of child abuse.